patients. Had some great questions today. Patients wanting to know about elbow pain, patients wanting to know about shoulder pain. Had a torn rotator cuff, had some plantar fasciitis going on. When our elbows get stuck, which is really easy, let's say we're going to sleep, right? And we lay on this all night, and this gets really, really tight. And then we go to do something in the morning, and it doesn't rotate, and it doesn't want to flex, right? So if you lose that and it's stuck, then it's twice as hard for the muscle to move this around. So now when you try to lift your arm up, it hurts here. Because it's tight here, it ends up hurting here. Then what happens is you get stuck in the ribs, stuck at the sternum. You can feel the joints that are right here. They can be rolled up, down, over. They can come up, this way, forward. The ribs can be turned and twisted. Many of you heard me talk about the pickle jar, right? Yes, the pickle jar. When you take a lid and you take the body and you're going opposing directions, that's what happens here. It takes the lid and takes the body, and you have opposing torsional forces that now hurt, and it creates neck pain. So sometimes we'll get rid of your neck pain by releasing the elbow and taking, but all you ever felt was symptoms here at the shoulder, which you thought was neck pain. And so all these things, they work together because you're connected, right? They're not separate. They are all connected. So here, when we do a thorough job, if, let's say I only adjusted your rib, or only adjusted here, or only adjusted where you hurt, I would actually miss a big part of the problem. And then as a patient, you would have to come back and back and back, and you wouldn't understand why the adjustment wasn't holding, or why you felt like really sore when you woke up the next day. So restrictions, not good. A lot of people go, I stretch and go to the gym. That's what I do with my restrictions. The problem is you can't stretch your joint. When a joint is stuck, it's locked. And when you go to stretch, you stretch here or you stretch there. You're not actually stretching the tissue that gets locked. And what happens over time is the bone starts to change form. So now that you've seen how the joints can change, that is simply because it wasn't moving and the bone starts to disintegrate because it needs movement through there. There's an electrical system where charges and pressure create you to keep your bone. Those of you that have had a fracture, been in a boot, and you've had multiple x-rays, you've seen that your bone structure gets lighter when you don't put it in there. So, this is really confusing for people. Chiropractic still is fairly new, and it's really misunderstood. We are not popping joints. We're not putting things in and out of place. What happens is a joint locks up and gets restricted, or it becomes sloppy and hypermobile. Otherwise, it's completely normal and working great. You don't need us to work on it at all. And that is a huge, huge thing in my profession. We must work on the correct segment. So every time you come in, we will be palpating your spine and moving the joints, taking them through their full range of motion, because we are going to find the specific area that you're stuck, and we will only adjust there. And wherever you hurt, which is probably wherever your body took the work it was supposed to be doing here and shoved it somewhere else, we call it passing the buck in the Midwest. But if I take the job off here and make this one do two jobs, this one hurts. And if I pop that or try to put it into place, I can be stretching something that's already hypermobile, and it can confuse you, kind of like rubbing if I bump myself and rub it. It confuses the pain nerves for a moment, but it is not a long-term solution. In fact, stretching a sprained ankle would be equivalent here, right? So if the neck moves too much and I go to stretch it, it's sprained and we got too much. So if the middle of the back and I'm moving it and it doesn't want to move, then that movement goes somewhere else, okay? So as I'm palpating the joints, if it doesn't move at all, or if it's really straight and it moves a lot on one segment but it doesn't move to here, then we can lay you on your back, or we use the board and we adjust this open, and then what happens is you can move. from side to side again. Okay? That movement becomes really important as long as the whole entire team works. Now, what happens if you don't? Let's say we don't do that. We don't get an adjustment. Over time, it can get locked. You can have something called a displacement. This is really common in my gymnastics. Even little kids, people who have had trampoline injuries, maybe an old motorcycle wreck, but you can get caught up in this area where these get actually twisted, and we call that a malplacement. So we've got to actually get that back to center, or you're going to have nerve problems. And the nerve is the most misunderstood thing. Most of you, we've talked about that. Depending on which level, it goes to different areas. So, hope that explains restrictions and hypermobilities. We will be making sure that your entire system works. And it is just a pleasure to adjust you. Aloha!